the NHS is in critical condition, but its vital signs are strong. Our collective challenge is to take the NHS from the worst crisis in its history, put it back on its feet, and make it fit for the future. The budget was important. The Chancellor gave us the investment we need to arrest the decline, begin fixing the foundations, and start turning the service around. The NHS was the standout winner. We're delivering the largest health capital budget since Labour was last in power, and the biggest cash uplift in day-to-day spending of any government department. There have been two predictable reactions to this. The first says that the NHS is getting too much money, that this is a black hole that consumes ever-increasing amounts of taxpayers' cash, and that the NHS will complain that it's never enough. So right on cue, some NHS leaders popped up in the newspapers, aided and abetted by the health think tanks, to complain that this isn't enough. Well, one of the luxuries of leading a think tank is that you don't have to engage with the choices and trade-offs that government does. The Chancellor had to raise more than £40 billion to plug not just the £22 billion hole we walked into in July, but also to fix the foundations so that our economy and our public services can recover from years of mismanaged decline. When the Chancellor announced the settlement for my department, she joked about how unpopular it would make me around the cabinet table. And the truth is, at the cabinet meeting in which she set out the contents of her budget, I did feel uncomfortable. Not because I was worried about the opinions of the people in the room, because they support the NHS and the investment, but because I am worried about the jobs they have to do.